Hello.
Hello.
Doc.
Yes.
I'm wondering, are you the one teaching or I am the one?
Oh, are you the one? I don't know. Why?
This is week 5, so it is my topic today, according to the course outline at least.
Oh, which one did I check?
Course outline.
Then I must have checked the wrong one. The one on the e-platform. Alex,
Yes, Doc.
if it is your lesson, you can go ahead.
Shinga is already pushing us to the YouTube platform.
Yeah. In fact, I was trying to get the procedure of how to go about it. So I will just remove mine.
Okay.
Yeah, let me remove mine so that you can mount yours. Where now do I remove this? Share your screen. Oh, stop sharing.
You've already done that.
Oh, okay, fine. All the best, Alex.
Thank you.
Because me, I
You are currently the only person in this conference.
Aje. Nataka kushare screen.
You are currently the only person in this conference.
Hello. Okay, thank you. So a minute. So welcome to this class today. We're going to talk about, how drugs and alcohol usually lead to HIV infections or progressions. So I hope everybody can hear me. If you can hear me, then you can type something on the YouTube platform, so I know that we are going on together. Shinga. Sawa. So if everybody can hear me, then let's go on with this lesson. Can anyone hear me now? Okay, thank you. So you can push me against Shinga. I don't know if you can hear me. Hello, people. Shinga, can you confirm if the students can hear me on YouTube? I can't access YouTube right now, so
I have tried typing the link. I can't find it. I don't know if it is there because I've typed CCS 103 and I'm still.
Good. So, Susan, you can search again. All right, okay. So I welcome you again to this class. Sorry for the delays. The internet had issues, and of course we had some power surge in the place where I'm seated. So nevertheless, like I was saying in the beginning, today we are going to look at how drug abuse and substance abuse leads to, is connected to HIV and AIDS infection. And, we learn on some of the measures that we can take so that we can prevent ourselves from infections due to, other secondary factors which we are aware of. So we'll start by defining what a drug is. Of course, a drug is any substance that, other than food, we normally, that is inhaled, injected, smoked, consumed, or absorbed through the skin, what we call topical application. Or sometimes it's usually, dissolved under the tongue. So some tablets are usually placed under the tongue so that in the event you achieve a certain reaction in your body. And this reaction is usually, manifested in how someone appears or even the change thereafter. So other definitions include any chemical that is used to treat illnesses. Of course, these are prescription drugs that are given to individuals when they suffer from certain disease that is diagnosed. So also people take drugs for pleasure so that you can have that ecstatic effect on your body. But sometimes most of these that have ecstasy are usually illegal. But of course, people still take them under hidden conditions or places where they cannot be reached by people enforcing the law. So again, some of these, most of these were then when taken, like I said, a drug when taken usually causes an effect on the body. For example, if you take a painkiller like aspirin, then you expect that the pain that you had in your body is usually going to disappear. Not just aspirin, but of course many other like paracetamol and so on. So similarly, when one smokes bang, for example, they experience a change in the mind. You start hallucinating, seeing things that are not there. And so these are some of the physiological effects that drugs have on your body. So drugs are usually administered using various ways. One of it includes oral administration by way of mouth. Of course, this is the main one. People take drugs for purposes of medication, for purposes of ecstasy, and so on. So this is administered orally. Some are administered by way of injection. So many in liquid form, and through inhalation. When you walk on many of the streets in major cities, you see street children sniffing or inhaling what we call cobbler's glue. This is an example of some of the drugs that are inhaled. Tobacco is one of them. Or they can be applied directly on the skin. Like I said, it's topical. You just wrap and then it joins to the blood vessels, and eventually it causes an effect. Some of them are inserted in the rectum. So for the purposes of quick absorption into your the vascular system, then it can be inserted in the rectum, the rectal area. Why do people take drugs? We have to talk about this because, other than, the effects that, HIV drugs have that might take someone to HIV and AIDS, we realize that we have other, emerging issues that happen when someone is subjected to or involve themselves in drug abuse. So some take them for relief, to relieve pain, and also for treatment purposes. Others control emotions. They are so, emotional. So there are those drugs that are usually taken for the purposes of controlling those emotions, for relaxation purposes, so that you feel you are relaxed, maybe you are tired or so. Also relieves tension and boredom, as well as enhancing sexual performance. Of course, we all know the blue pill, Viagra, and so on. So these are normally taken for purposes of, enhancing sexual performances, and also as a sedative, so that if you want to have if you have amnesia, you cannot sleep, then usually these drugs that are prescribed for you to take them, and then you sleep you sleep enough so that you can achieve your optimal performance. So how do we know that someone is abusing drugs? There are various ways of knowing this. So one of it is that this guy or this person normally isolates themselves from those people who are close. So they find themselves not, wanting to associate with family members or friends, because mainly these people are the ones who are trying to coach you into good behavior. But now you are trying to deviate. So they shift away from friends and family. So they don't want to be reprimanded. So they spend time with new friends. These are the people who usually, quote unquote, recruit them into the system of enjoying drug abuse. So these new people are the ones who are now, you like associating with them, because mainly you share a common factor. So you keep on hanging around with them, and then you get some drinks, you get high, and basically that's one person who is in the verge of abusing these drugs. So they usually, they are borrowers, they're heavy borrowers. You keep asking someone, every now and then they keep asking for money from family, friends. So these are some of the characteristics that you can be able to, note about someone who is really into drugs, because you need to sustain buying these drugs. Sometimes they are very expensive and you're not productive. So your economy, your pockets are dry, but you need to sustain drug and substance abuse. So you keep on borrowing money all the time. Showing up late for school and events that are necessary, the daily events in your life. So you are late because the drugs that you had maybe yesterday had a toll on your body. So you need to revive yourself before you attend class or work. So these people show up late, and in many cases they are not even sorry about it. So they are, of course, the optimal production levels at work goes low, because when your body is not functioning normally, then your production levels also will decrease. So this is a characteristic of one characteristic of a person who is who is abusing drugs. Of course, this is not only linked to that. So they pay also less attention to hygiene. Most most of the time you find these people, they smell so badly, but they don't care. They don't even change clothes. So this is one of the characteristics of people that are abusing drugs. There's changes in sleeping habits. There are some of these drugs that they sustain your body for a long time. So you become ecstatic, you are hallucinated, you cannot sleep on time, and so your sleeping habits keep changing because of effects of drugs. So they are also very private. So when you find this person sometimes, say in a corner, then in their car, you want to enter their bag, you usually know him or her, but nowadays, they don't want you near them. They don't want you to access their belongings because probably they are hiding things that they don't want you to access. And they keep lying about, they deny, they are in a state of denial that actually they are not, no, I'm not taking drugs, I'm not this and that. So that is one way of detecting that this person could be lying about something that they don't want you to know. And they also sneak away most of the time. If you are having conversations with this person, then all of a sudden they disappear from you. So those are some of the characteristics, some of the or the definitions, how drugs are administered in your body, and some of the characteristic features, how you can identify someone who is abusing drugs. So some of the drugs that are usually abused or that are linked to HIV and AIDS infections include the following. These drugs subject to, in one way or another, they have been linked to HIV and AIDS infections, and also, increasing. If you're already infected by HIV, then if you take drugs, it's shown that they will exacerbate the effects on your body because there are very many things that you'll not be considering anymore. Your treatment regime, if you are on ARVs, then you say, to hell with it, you'll deal with HIV later, and so on, like we'll see later. So alcohol is one of it, is one of the drugs that when abused, when you take it in excess, then it is linked to HIV in this way. So you engage in risky sexual behaviors because at that level, when you take in too much alcohol, then you end up having what we call impaired judgment. So you will not be thinking on your feet. And so you'll just say whoever comes around, then you sleep with them. They might be HIV victims or they might be having HIV, so you are also going to be infected. At that stage again, you'll most likely be subjected to multiple sexual partners. And so one person have sex with the other and the other one in a group of drug abusers, alcohol abusers. Then in that case, of course, the multiplier effect of infection goes on. It can also hurt treatment outcomes because, as we see later, alcohol, for it to be broken down in the liver, there are enzymes called dehydrogenases. So these enzymes usually are supposed to do the dual purpose, what we call breaking down alcohol, and at the same time breaking down the ARVs for the body to assimilate. So if you have if we are having two components that are competing for the same, then most likely ARVs are going to be affected. So you'll not have the desired effect on your body. We also have opioids. These are basically drugs that are usually administered to reduce pain. So if you have pain in your body, these are the drugs that are usually administered. Of course, some of them are useful. For example, in America, most of the soldiers, or even in Kenya, that come from war, they usually administered opioids for some time so that they treats the pain that comes from, the effects of war. So, but you realize that most of these patients, when prescription prolongs for a long time, then they realize that you're addicted to opioids. So when you're addicted to opioids, there might be you might reach a point of no return. So you keep on taking opioids. And therefore you'll be exposed to HIV, because what happens is you want to conglomerate or associate with people who are also taking opioids, and in the event you start sharing needles, you start sharing the materials that are used to administer these drugs into your body, and therefore again that comes exposures. You are not thinking right, and sharing needles, as we saw last week, is one of the ways that might subject you to HIV, and so that's another way that opioids is linked to HIV and AIDS. We also have methamphetamine, the meth or crystal meth that is very famous nowadays. It used to be very prominent in Americas, but as we talked about I think 2 weeks ago, the coastal area and Nairobi is one of some of the leading centers or hubs for drug and substance abuse, methamphetamine being one of them. And of course, it is linked to risky sexual behaviors. So when you're injected again with meth, then you are most likely to have or to get HIV by way of injection, and also risky sexual behaviors that are not controlled. We also have crack cocaine. The crack coke is a stimulant. So people tend to, in this case, because it's a very addictive drug, you want to sustain, you want to get money to keep on buying this drug. Then in the event, some people engage in, prostitution so that you can get money as well to sustain crack cocaine in your body. We also have inhalants. They are linked to risky sexual behaviors, illegal drug use, and sexually transmitted diseases among gay and bisexual men. So these guys usually take these things to get high, and then they engage in homosexuality. And this, of course, subjects them or makes them susceptible to infections of HIV and AIDS. Therefore, use of drugs and alcohol is generally associated with. So you are most likely, when you are an abuser of drugs and alcohol, excessive alcohol, then you're likely to engage in sexual activity with more than one partner. And that, of course, is a very risky behavior, because you're most likely going to have the multiplier effect. The increased rates of HIV, STI, sexually transmitted diseases other than HIV. Of course, you have likes of syphilis, gonorrhea, and so on, herpes zoster. So these persons, because of the unhygienic conditions in which they subject themselves, they are not taking proper medication. The hygiene is very low. Then infections such as STIs will come in. There is also decreased rates of condom use, because at this moment in time, like I said, there's impaired judgment, and So at this point in time, you're just saying to hell with condom as well. Wacha tu tuendelee vile iko. So in this case, again, you are subjected to, you are subjecting yourself to HIV and AIDS infection. There's also increased risk of transactional sex. Like I said, you are most likely to engage in prostitution for the purposes of obtaining money to go buy the drugs. You are addicted, so you need to get money. You are not working. Your body is weak, so you cannot engage in active physical activity that can earn you money. So one of the ways is involve yourself in transactional sex so that you can earn money to sustain the addiction. So you're going also to, you might use an infected needle in case of, applying these drugs in your body. And it is known that HIV virus can, depending on the conditions outside of the body, then it can survive for up to 42 days. So if the conditions are almost similar to those of the body, then this virus is known to survive for up to 42 days. So you need to be careful with the needles that you use. You might say that this needle has, imetolewa kwa mwili ya huyu jamaa for like 3 hours already. So I can now use it now. You need to do sterilizations if you are going to be sharing needles. And sterilizations include methods like autoclaving, direct heat, I think are about 170 degrees or so. And this could be a sure way of eliminating the virus, but this is not a sure way. So the only way is really to use your own needle, stay to it, or purchase new ones. Also, use of cocaine is associated with anal sex. This is among the homosexuals, and this is of course linked to, like we said, some of the people that are highly affected by HIV infections around the world are the homosexuals, so people who have men who have sex with men, because the rectum area is not meant for sexual intercourse. The membrane is a bit weaker, so the virus can easily penetrate into your body. So some of the manifestations or the progressive or ways in which alcohol and drugs lead to HIV infections or increase in HIV, manifestations in your body in the way. So this is the link between alcohol and drug abuse to, HIV and AIDS infections. So it tends to decrease adherence of ARVs, so antiretroviral drugs and other medications. So like we'll see, what happens is that is what we call down here drug to drug interactions. And for example, methadone, which is an opioid, and alcohol, they usually, would compete with the ARVs and increasing toxicity. So when there is that interaction between alcohol and methadone, then ARVs possibly increasing toxicity, or thereby affecting the effectiveness of the virus. So it decreases the adherence of ARVs to, the immune systems of your body, and so HIV is therefore allowed to reign or to control your body. Excessive use of alcohol has been shown to cause immune suppression, impaired macrophage functions, impaired B cells activation and antibody response. Again, it suppresses the immune system. And when the immune system is suppressed due to the effects of alcohol, So overall, you have a system that is, susceptible to the secondary infections of AIDS. So drug use again may affect the overall health, making them more susceptible to HIV infection. Overall health, because part of the things that people who are drug abusers do is that they don't eat much. So they don't eat healthy foods, fruits are neglected, and therefore your body is reduced, and you are therefore going to be susceptible to HIV infection and AIDS. They can also be because of impaired judgment. You can overdose yourself with ARVs. You're not thinking right, so therefore this has been. Of course, these drugs are usually, they take a toll on your body. When you see someone, or you might have heard of someone who is taking ARVs, then their body systems really get very weak. And you can imagine what happens when you overdose yourself with these drugs. So again, alcohol and drug use are associated with stigma and discrimination. So when someone is stigmatized or discriminated, then they really would want to dissociate themselves with things like diagnosis. You don't want to seek medical care. So that is as a result, because you are delinking yourself from family members, your friends, and so on. Then that stigma alone, self-stigma, and also, from your friends, you don't want to be diagnosed early. And so you might, if you have the virus, the likelihood of, multiplying it among other people, as well as being reluctant on your body, again, will lead to delay in diagnosis, and therefore maybe this could lead to early death as well. Signs and symptoms of alcohol and drug addiction may overlap with those of HIV, AIDS, further complicating and delay early diagnosis. So you really don't know if this person is just a drug addict, or there are other diseases that have crept in, like HIV and AIDS. So these symptoms usually overlap, and it's more complicated when someone has, is engaging in drug abuse, and at the same time they have HIV and AIDS. So this really is another very, very complicated situation in terms of managing the disease. And again, this is the drug and alcohol, like we said, this leads to poor health. And so you will be subjected to comorbidities, which delay diagnosis and complicate management or accelerate HIV progression and substance abuse. So comorbidities are these other diseases that because of poor health, then because of poor health as a result of alcohol and drug abuse, then you're subjected to things like dementia and so on. Is when they again mix with HIV and AIDS, then this complicates the management of HIV and AIDS. Yeah. Sharing needles. We are continuing with how drug and substance abuse leads to progression in HIV, management issues, and so on. This puts people at risk of getting viral hepatitis. And when you have viral hepatitis, of course, this is like, the opportunistic infections that lead to progression in HIV quite fast. So people that use injection drugs may lead to hepatitis, which is associated with decreased survival and increased HIV progression, which is a marker for poor treatment. So alcohol use and drugs such as opioids, cocaine have been shown to increase HIV replication and cause impaired lymphocyte function. This is sort of like a replication of, because alcohol leads to suppressed immune system, and so your body is subjected or is susceptible to HIV. Alcohol again deteriorates the liver, which is important for the metabolism of ARVs. Like I said earlier on, the drugs, the ARVs and alcohol usually compete for, or dehydrogenesis that usually is responsible for breaking them down in the liver. So if there is competition, then one of them is going to suffer, and woe unto you if it's ARVs. So your body will be opened up for infections because of alcoholism. Alcohol and malnutrition, I think I've repeated this. When you are poor, when you are an alcohol and drug abuser, then you don't really concentrate much on the food, or the food that usually boosts your immunity. And in the event, then you're going to open up your body for infections, including HIV and AIDS. So again, HIV patients who consume alcohol, if you are HIV and you consume alcohol, you're opening up your body for opportunistic infections developed during periods of ARV disuse and other immune system abnormalities. Sex workers that who inject drugs are more likely than non-injecting sex workers too. So we have sex workers that normally, inject drugs. You want to get high so that you can engage in this activity. So you work in risky ways. So you probably have these guys having sex on the streetways, highways, so places that subject you to non-protection methods. You want to finish this activity quickly so that you can have money. So wherever it is, then let's go down with it. They have unprotected sex for additional payment. Most of the clients usually would tell them that, look, I'll give you a money if we engage in this activity without protection. So that again, you are subjecting to yourself to infections. They have more clients per week. Those that inject drugs have more clients per week because they are open enough, they're accessible. And this, of course, brings in the multiplier effect of HIV and AIDS. They have sex partners who are injecting who are also injecting drug users, IDUs. And again, that is another area of susceptibility. Then they also share equipment, the injection equipment. And this, of course, leads to infections directly. So when injecting drugs, therefore, here are some of the ways to lower your risk to get HIV and other infections. Use only a new sterile needle each time you inject. You are advised to use a new sterile needle. You never share these needles. It's common practice that you don't do this. Clean used needles with bleach, or what you call sodium hypochlorite, so that you disinfect the needle when you cannot get a new one. Of course, this is not a sure way. It's one of the ways, but you're not guaranteed that all the viruses are going to be cleaned. So again, never share needles, use new ones. So bleaching a needle may reduce the risk of HIV, but does not eliminate it. That's a warning. So when you're also injecting using a clean new needle, clean your skin so that you don't, like the common practice in hospitals is that what they normally do is take a swab of alcohol, which is normally 70%, and then they wipe on your skin. This helps to eliminate, viruses, bacteria that are usually associated with your skin, and then they don't, get into your body. So don't touch someone else's blood on your hands or your needle. Dispose needles safely after use. Of course, there are usually containers that are called for sharps. So you dispose them there, and most importantly, get tested for HIV and AIDS regularly, so that you know your status and therefore subject yourselves to management strategies. And if you can't do all these things, of course, there is pre-exposure prophylaxis. These are drugs that are taken before you are involved or in an infection method. And also the post-exposure prophylaxis. These are drugs that are normally taken when you think that previous engagement may have subjected you to HIV and AIDS infection. So with that, I would like to end this lesson for today. I will try and look at the chat if there are any concerns, any questions, so that I'll try and engage them. Kindly, sir, upload notes on e-learning portal so that we can access it. Of course, if you go to the online platform and search for CCS 103, you are going to access the notes for all the lectures in this unit. Yes, we upload the notes on the e-learning platform. Someone is saying, why can't you adjust brightness of your screen? My screen is very bright. Cynthia Mwende, the liver. What is the liver? I don't know what you meant by that. Are those drugs free? No, they are not. Most of the drugs, like I said, are sold. They're sold in, on the streets because they're illegal, and so many people engage in sexual activities, prostitution, so that you can get them. When is the cut? That is a very important information that I need to pass to the class. Let me get the email. So we are scheduled to give a cut 1. Listen carefully. So we are scheduled to give the cut on 17th of October. 17th of October. I'm checking the dates. That will be on a Monday, 17th of October. Some are saying 17th of October, so you prepare yourself for cut 1. We'll give you communications very soon on how this will be transacted. course, it's a physical meeting. You attend to the, you'll be required to be in your classes where you meet from after these tutorials. So 17th of October, you prepare yourself. The CAT is not online. Someone is asking what is there a tutorial after this? Yes, you will go to your various classrooms, physical classrooms, to meet your lecturers. PrEP is pre-exposure prophylaxis, meaning that before you engage in a risky sexual activity or an activity that makes you exposed to HIV and AIDS, then there are these drugs that you can be able to take them and prevent yourself from infections. So of course it's not. It is said that PrEP and PEP are usually 99%. They have a 99% chance of making you not to contract the virus. But the sure way is really to prevent yourself by methods that we already know. CAT costs how many marks? 30 marks for CAT 1 and CAT 2. For CAT 1 and CAT 2, so 30 marks, and then the main exam is 70%, or 30% at 70%. This will give you 100%. Exam timetable, no, we are not at the moment in position of sharing a timetable. Time for the CAT, we'll again confirm that again and communicate to you. What about sharing utensils? No, they are no linked to. There has been no link to people sharing utensils and HIV and AIDS. Of course, you need to be careful that you wash your utensils so that the person who is HIV and AIDS infected. And they have sores in the mouths, then you need to be careful at all times. Are we going to be penalized on spelling mistakes? You at this level, really, I don't think you have spelling mistakes as a university student. English should be one of your top languages that you are speaking and writing at the moment. So do you take PrEPs as dosage or once before engagement? There are prescriptions, of course, that you are given by the doctor, so you stick to those prescriptions. Sometimes I think it's once per month or so before the exposure. I was answering someone who asked, where does alcohol attack in human body? And I've said liver. Where does alcohol attack? Alcohol is consumed, of course, through the mouth. And then what it does is that, the body, it goes to the stomach and then to the liver, where it's broken down to various components. Then there is the effect, which is usually, the fact that alcohol can cross the blood-brain barrier other than oxygen and water, then that causes the staggering effects, the misjudgments from the brain. So we cannot really say it attacks the liver. Of course, one of the the first steps is the liver, because liver is supposed to break down so that your body can be able to to manage it. How many topics are covered in the CAT? The CAT will, of course, will cover all the topics up to the week before the exam. So when you have a CAT like next week, then this week's lesson will count. Where do you get PrEP? Many public hospitals should give you this. And sharing of pumice. I don't understand what pumice. From my geography, I only know pumice as a volcanic rock. So maybe you can just a carry. Is use of abbreviation allowed during exam? No. Of course, abbreviations like HIV and AIDS are common, so if you write those, then that's okay. But you cannot keep on writing abbreviations for everything. Are phones allowed in exam room? No. If you read your student manual, there are those rules that govern examinations. So this really is not one of those forums. So thank you for attending today's class. From here, you proceed to your various classrooms where you'll be explained further. You'll have a tutorial with your unit lecturer. And for those who are asking if it's CCS 103, no, or 101, no, we're just teaching CCS 103, which is HIV and AIDS. And please stick to your various classrooms as per the timetable. We don't want to have a mix-up of people who are you're taking education at the same time attending a class for business and so on. So stick to your timetable, and then you will be fine. Thank you for your lecture. Thank you so much, and see you soon.